So hello everyone, my name is Paul, and today I'll talk to you about medicine in ancient Egypt. Now, I've chosen this topic because I think people should know more about the history of medicine, particularly that of ancient Egypt, because it's great for your general knowledge. It shows just how advanced this ancient civilization was for its time, and also it represents to some extent the foundation of modern medicine. I will explain why in a few minutes. So in this paper, I'll mostly focus on three areas of ancient Egyptian medicine, namely historical sources, theories and conceptions about the human body and illness, and medical practices. Now, the Egyptian civilization, one of the oldest in existence, has left a mark on the world through its cultural manifestations, which represented kind of a peak of development in the history of humanity. And in this sense, medicine is one of the most important fields because the Egyptian people enjoyed a highly developed medical system and practitioners with vast knowledge in the field thousands of years before the Greeks and Hippocrates. Even the great poet Homer said that the Egyptians were more skilled in medicine than any other art. But how do we know this? How do we know exactly how skilled they were? Well, it turns out when it comes to historical sources, we have a few paintings of surgical interventions discovered in tombs by archaeologists, but most importantly, we have four papyruses from this period: the Ebers Papyrus, the Cahoon, the Edwin Smith, and the Bruges Papyrus. And all of these contain clinical observations, including diagnosis, symptoms, and treatment of the most common illnesses. The Ebers Papyrus, which is pictured above, is the oldest medical document ever recorded. It dates back to 2000 BC, and it was discovered in 1875. It was named after German Egyptologist Georg Ebers, who discovered it in the ruins of Thebes, and to this day remains the main document for studying medicine from this period. It's very comprehensive, contains information about eye, skin diseases, gynecology, surgical practices. It's 20 meters long, and it contains over 400 types of medications and over 800 prescriptions. The Cahoon Papyrus, the second oldest one, dates from 1825 BC, and it was discovered in the Egyptian locality of the same name. It's mostly a gynecology document, so includes information on pregnancy diagnosis, the functioning of the reproductive system, and pharmaceutical procedures to prevent infections. The Edwin Smith Papyrus dates from 1600 BC, and it was named after American Egyptologist Edwin Smith, who purchased it in 1862. It essentially focuses on traumatology, which is the branch of medicine that studies wounds and injuries caused by accidents. It was initially a manual for the use of war surgeons, and it describes 48 cases of head, shoulders, neck, and chest injuries, including details of the symptoms and various remedies. And finally, the Bruges Papyrus dates from 1300 BC, and it was named after German Egyptologist Heinrich Karl Bruges, the first person to study this document, and it mostly contains information about respiratory diseases, pneumonia, laryngitis, tonsillitis, and other stuff. Now, if we move on from historical sources, we can talk a bit about theories and conceptions of the human body. So how did Egyptian doctors think that the human body functioned? Well, it turns out it was quite different, but also surprisingly similar to what we know today. Much like medicine in ancient Greece, Egyptian medicine was not founded on a solid knowledge of anatomy because procedures such as dissections, which could have provided a lot of useful information in this sense, were largely forbidden. And this lack of knowledge was compensated by a synthetic, integral conception of the human body. Basically, the notions regarding the functioning of the body, what they would call physiology, did not refer to individual organs, but to the entire organism. And this philosophy was called the integralist philosophy, according to which the human body was seen as one entity with no separation between systems of organs with specific functions as we know today. Basically, according to this conception, blood had the coordinating role, spreading to the entire organism an imperceptible element from the air, and this element called pneuma, P-N-E-U-M-A, would spread to the body, would gather in the lungs when a person breathes, and it would spread to the body with every pulsation of the heart. And this was considered essential for the functioning of the body, for repairing damaged areas, and its loss would equate with death. So I guess kind of like oxygen. And the Egyptian people can be considered among the first to discover that air is essential is the main source of life for organisms, and its transformations within the body lie at the origin of both normal processes and various illnesses. And even more interestingly, the Bruges Papyrus contains the first description of a respiratory act, which is surprisingly similar to what we know today. I'll also quickly mention that Egyptian doctors paid attention to the brain, which was thought to be the control center of the entire organism, and also the space where thoughts were born, although how that happened remained kind of a mystery. Also very important was the heart, whose main function was to supply the body with blood, but also was considered the space for the human soul. Now we can move on to when the body doesn't function right, namely illnesses. So the branch of medicine that studies the cause of diseases is called etiology, and Egyptians believed that the individual was born healthy and that disease was a result of external factors. As previously mentioned, with the papyruses, the list of common illnesses was very long, ranging from eye conditions to skin problems to digestive and respiratory issues. And what is unique about the Egyptians' conception is that is the extent to which medicine, as we know it today, and religion were inseparable at the time. In fact, Egyptian doctors admitted the existence of material factors such as wounds, parasites, changes in temperature, imbalanced diet, in which case the remedy, the treatment would include a natural remedy made from plants, herbs, honey, even the fat and venom of animals. However, they also admitted the existence of a different kind of factors, more mystic in nature, curses, the devil, or divine punishment, and these could only be treated via magic. So they would often resort to potions, incantations, amulets, and they would also advise patients to pray for their health in the temples dedicated to major Egyptian deities, especially Isis, Osiris, and Horus, who were all considered to some extent protectors of health. Okay. Now the final part, and probably the most interesting, is related to medical practices, and I'll talk about surgeries and mummification. So the oldest and most advanced specialty was traumatology, and much of the information about a person's health came from observing the mobility of their neck. In case of usually having a limited mobility meant that you were suffering from some kind of illness. And in the case of multiple traumatism, first aid started with the most important parts of the body, usually the head. And the Edwin Smith papyrus contains a lot of information on fractures, contusions, and the practice of immobilizing arms and legs using splints made of reed and palm tree fiber. One of the most commonly used practices was that of trepanation, which basically meant perforating the human skull and exposing the first membrane that protects the brain in order to treat cerebral diseases and to release blood buildup from an injury. And disinfections were done using products made from antibiotic plants. Egyptian doctors generally performed surgeries without a very deep knowledge of human anatomy. But out of all fields, let's say, out of all branches of surgery, ophthalmology was the most renowned, the most well-developed. And they would use, for eye surgeries, doctors would use local anesthesia made from a mix of limestone and vinegar, while for general anesthesia, they would resort to, or for more complicated cases, they would resort to hallucinogenic plants, especially opium, which they had plenty of. Most famously, the Egyptians were among the first people to master the techniques of embalming and mummification, procedures which are unequaled as methods of conserving the human body. The process of mummification would obviously take place after the death of an individual. Craftsmen would remove and examine different organs. They would use various potions, oils, chemical products, basically anything to ensure that the human body would arrive in optimal condition to the other world. First of all, they started with the brain, which was liquefied by pouring palm tree oil through the nose, and then it was removed using a long instrument with a hook. Then other craftsmen would remove the organs considered to be the most important, such as the stomach, the liver, the intestines, and the lungs. And these were kept in 4 canopic jars representing the 4 sons of god Horus, who protected the person's remains into eternity. And finally, the corpse was wrapped in bandages in order to protect the body from rotting. I should also mention that in theory, mummification was accessible to everyone, so it was open to people of from all classes, but in practice, very few members of Egyptian society could afford to pay for the expensive process of preserving their bodies in the afterlife. So, in conclusion, ancient Egyptian medicine, although still carried heavy marks of religion and mysticism, was grounded in advanced scientific knowledge for the era, which crystallized through thousands of years of studies and observations. And thus, medicine played a crucial role in the development of the ancient civilization on the Nile Valley, exerting a major influence on today's conceptions and practices in the field. Thank you for your attention.